Back to Ebola, tackling the disease is high on the global public agenda. A new analysis from the World Bank finds that the virus could pack an economic blow to already fragile African economies. New public-private partnerships are pulling together to recruit and train a stronger healthcare workforce. Khalil Gueye reports.
A World Bank group analysis of the Ebola epidemic finds that beyond the toll in human suffering, the surge could deal an economic blow to fragile countries.
But we did take a step back and ask the question, what's going on in terms of the overall economic impact? So just in terms of this year, between now and the end of 2014, the overall impact in loss of GDP will be around $360 million. And the impact on governments' budgets reaches almost that number as well, close to $300 million.
High-quality services on the ground which prevent new Ebola infections and treat those affected are critical.
One of the things that many of the public-private partnerships are working on are to improve health systems. So that is everything from ensuring that commodities reach the areas that are hardest to reach, that we have trained and skilled health workers. One of the saddest things that is happening now because of the Ebola outbreak is that many of the health systems and health workers are strained to their limits.
Mohamed Yunus, the founding father of microcredit and the 2006 Nobel Peace Prize winner, says public-private partnership for social good will bolster health systems.
It's a health issue. So I think all health issues can be addressed as a social business. How to do that? It's not just Ebola came, it's not a social business, it's not a medicine. It's a methodology, how you approach it. So this approach can be used for any diseases, any health issues and so on. It's a creative idea how you apply that.
The immensity of the suffering in West Africa and the enormity of the Ebola challenge is a priority for the United Nations. UNFPA reaches those who cannot access hospitals or health centers.
And in the countries of Guinea, Liberia, and Sierra Leone, which are where this is ravaging, we're there working with our partners, making sure that we provide protective care, making sure that we also provide information to the population about transmission. Because really at this stage, it's about breaking transmission. Once we break transmission, then the epidemic will go down.
The message from all sectors is clear. A massive, complete response is required as quickly as possible. A comprehensive approach is essential, from the top down to the bottom up. The public-private partner response must be swift to succeed in containing the Ebola epidemic. Khalil Gueye for VOA News, New York.
And that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Lenore. Be sure to watch Lenore Madu's Health Reports every Tuesday and Thursday, right here on Africa 54.